to you all for this session about advancing healthcare system through digital health technologies, artificial intelligence, and smart healthcare systems. I understand this is one of the last session of the day, so maybe you all are full with the knowledge and the day-long activities which has happened here. So I'm going to keep it very straight, specific, and short panel discussion. So as it has been said, that we have to work for the digital health enabled and AI-enabled care system. So my first question goes to Dr. Parvez Ahmad, who is Joint Manager Director and Medical Director, Chandan Hospital, Haldwani, that as you see that number of patient and footfall in your hospital is increasing and the patient, they are walking in with the complex problem. So how do you think that digital technologies can help in improving the patient care?
Thank you, madam, for a question. Let me tell you that Haldwani is a gateway to Kumaon region, and a lot of cities are located on a hilly area. And for the people who are living there, it is very difficult for them to travel to and come to the city. So in Haldwani as well as in our hospital, definitely we are efficiently utilizing the digital technology in terms of hospital management information system, which is well integrated, and all kind of reports, OPD, everything is connected there. At the same time, a lot of hospitals are facing the problem that is the waiting time. कि इस हॉस्पिटल में भीड़ बहुत रहती है और डॉक्टर को बहुत वेट करना पड़ता है. So for that, hospitals are using and advisable that they should use the digital appointment and queue management system. Then the third challenge is faced by the hospital about the pharmacy. That's a digital pharmacy and inventory control. And next is about the telemedicine, which is supposed to be efficiently used by the hospital. Thank you, because I'm keeping my answer short and
so just taking a lead from your answer that telemedicine is one of the way out to decrease the patient load and patient time. So I would like to know further from you only that how are you training your doctors and the healthcare workers to enable them to use these advancing technologies?
Now these are days which is the new generation is coming up. They are already technology friendly. आजकल तो बच्चे को भी मोबाइल चलाना हमसे बेहतर आता है. So definitely that HIS is well integrated in our hospital as well as in the advanced hospital. So efficiently they are using the PACS, picture as archiving communication system. So all X-ray, CT, MRI can be easily seen there. At the same time they are using the CDSS, clinical decision support system. So that's a very important tool because doctor cannot remember all the things. So that tools tell you about that this drug to drug interaction might be there or not. This drug is going to generate any kind of allergy. And at the same time, they are also guided by the following the clinical pathways and other things.
Thank you so much, Dr. Parvez. I understand clinical design support system is one very key important tool for such large hospitals to keep the errors at minimum. So now my question goes to Dr. Prashaant Kumar Bhatnagar. He is public health specialist from my own field of community medicine and associate professor at KKABM Subharti Hospital. So from you, I wish to know that in your medical college and institute, how you are enabling the artificial intelligence system to keep the system more effective and efficient.
Thank you, ma'am, for this question. In our hospital, we are actually implementing AI and digital systems in a phased manner. Because what I believe is technology is not a problem. How we implement it and integrate it, that is more important. And for a medical college and a tertiary care hospital, we already have our workflow systems. So the technology we are adopting, that should be such that it get adapted to our workflow system so that it doesn't create issues, not only for the non-teaching staff, support staff, and also for the doctors. So what I believe, what we are trying to do, we are having new innovations. We have changed our software recently. So what phased manner we are following, firstly, we are focusing upon building a strong hospital information system, software and also hardware. Then it deals with the training of the staff. That is also very important because yes, like sir said, that new generation is very much tech savvy, but our staff is not only comprising of new generation, there are some elderly people also, so that creates some confusion in them how to use that system. So we have to make it more easy and facilitate them to learn. So when the staff is trained, then comes implementation. And implementation should also be in a phased manner. Firstly, we will dealing with the OPD management, that queue management, OPD management, and later on things like laboratory we have integrated, then radiology, pharmacy, clinical decision making, that we are in the process of integrating. And also not only the patient management, for example, if we talk of the quality, like if we are dealing with the NABH protocols, then also it is important that AI can help us to find out that areas where we have problems, where there are shortcomings. For example, the ICU protocols, the area where we are lacking, so that can advise us also where we are lacking, so we can achieve the quality standard. So that is also very important.
Okay, thanks, Dr. Prashanth. So key learning from your answer is that we have to go in a phase-wise manner so that not only we train the younger generation, but the people who are elderly and a different phase where they do not have that much of competency, they can also be brought in the flow, and they can also be the effective people for the health system. So now, because of your public health background, I'm just going to pose a question for the public health reasons, that how do you think that these digital technologies, they can bridge the rural and urban divide of healthcare accessibility?
In my opinion, these new technologies are very important in bridging the rural-urban gap, and that is also very important in a state like Uttarakhand, the hilly state. We are, in our hospital, if I talk, that we have started a mobile medical unit on a pilot basis, and I would like to share with the audience that in a short of even a month, we have covered more than 2,700 patients in the hilly areas for that mobile medical unit. Our team is very dedicated. And now in the second phase, we are thinking that now we are offering the basic screening services there. But we can help some building some telemedicine there, so that online referrals can be done, online consultation can be done, so that we can provide healthcare to the people of Uttarakhand, people of hilly region, to their doorsteps. Also, for this rural-urban gap, we can have some wearable devices, so that so that patient can be good, vitals can be monitored, conditions can be monitored, and that information can reach to their doctors, so that appropriate action could be taken, appropriate advice can be given. So rural-urban gap can be definitely bridged by the use of AI and smart technologies. Thank you.
Thank you so much. One more question, Dr. Prashanth, if you can just say a few words about that. When we talk about the preventive diagnostics, we want to focus on the screening of non-communicable diseases. So what is your experience, if you have done anything around it, for the screening of the diseases with the digital technology?
Yes, that's very appropriate question, because we have a special focus always on non-communicable diseases. And the main thing is that this AI technologies and this system can help us to see, gathering data is not gathering data is not difficult. What is difficult is how we interpret it, how we concise it, and how we make out what we have to do. So we have the data of the patients, we have the continuous, for example, if we say of non-communicable disease, the glucose monitoring we have, or the we have the recording of the ECG. But it is important that these AI tools can help us to help the clinician to warn that action has to be taken, and the data can be concised, and a report can be prepared, so that we can know in which patient we have to focus and what are the areas that have to be looked upon. Thank
Thanks,
you.
Dr. Prashanth. Now coming to Dr. Miss Anima Rawat. from Wadhwani Institute of Artificial Intelligence. So you have been involved in developing different technologies across the country for diagnosis, prediction and treatment. So I want to know your experience that in which area AI has been the most successful in delivering the efficiency in the healthcare system.
Okay. So when we talk about impact within artificial intelligence, and I'll touch upon what we mean by impact, impact has to be longer term. It does not have to be small term impact where you show certain numbers and it does not last longer in the society that we are building it for. Impact has to be something that is built for the underserved where it's actually required, as well as something that can be embedded in the very infrastructure that these users are a part of, so that it can stay in the society for a longer term. I'll talk about certain examples from Wadhwani AI solutions. For example, we have an array of solutions for tuberculosis. We've been talking about TB throughout this conference and how we want to eliminate it by 2030. We have 4 solutions, AI solutions, which talk about identifying high-risk villages, which is vulnerability mapping, which gives you a ranking of villages in terms of where you need to focus your efforts in. So in terms of using your government's resources better, that's how you make an impact. Second is screening the individuals. We have an application which uses cough sounds to determine whether the person is presumptive for TB or not. So instead of sending everybody for testing, we tell you that, this person is presumptive for TB while this one is not. That's how you manage your resources again. We also have something which is prediction of adverse TB outcomes, where we, at the very onset of treatment, when a patient goes on treatment, the application can tell you that this patient is going to be either a loss to follow or maybe deceased. So these are the patients that you need to focus on. And this is where we try to make impact in terms of, adding to the human cognition and not replacing it with AI.
Thanks for your answer. Further, I would like to deep dive into this discussion, and I would like to know what are the common challenges manpower or community and the health force they face in adopting these newer technology.
Well, that's a very good question, and that's ubiquitous across India, because when you see these healthcare workers, they're not well versed with technology. Maybe medical officers who attain a certain level of education and the kind of socioeconomic background that they come from, maybe they are well versed with technology. But when we talk about frontline workers who are the linchpin of the society between community and the medical, the healthcare services, across states you will find that these people do not understand technology. They have very basic phones. Now they've started using smartphones, and they just use it to really follow the instructions that have been given to them. So when it comes to technology and AI implementation, upskilling and capacity building is very, very pertinent in today's society, which we as an organization also boast of, that we provide upskilling, not in terms of just, teaching them how to use our applications, but generally teaching everybody, whether it's government officials, whether it's frontline workers, medical officers, everybody, an array of users of our solutions, to tell them what is AI, make them understand the basic tenets of it, what is technology, why is it important. Once you tell them what it does, they will be interested to know that they need to use it, how do they use it, and what impact it's making in their lives. So of course, capacity building is something that can sort of break through the challenges that these healthcare workers face.
So thank you so much, Dr. Anima, for your very in-depth insight about this subject. So with this, I would like to conclude and wish to say that digital health is going to be the future. It's not going, it has already become part of our life, and if we want to succeed and make the system responsive and efficient, we need to learn it more and more and more. So with this, I thank all the panelists. Thank you so much.